Miranda.
And I'm Allison, and we are Hand Therapy Academy.
All right, today we have Allison on, and she is going to share an interesting case. And I'll let her present her case the way she presented it to me because it was very interesting. And you're like, I wonder what's going on. And I think when she tells you what's going on, you might be surprised.
This started with a patient who I was treating for a zone 2 EPL laceration that was repaired. Um, he came to us a little late, but not maybe at like 3 weeks or so after surgery, and we took him through the extensor tendon protocol. It was going pretty well, great thumb IP extension. He was doing well, but when it came down to it, he was a little further out. His IP joint was very stiff into flexion. Um, his strength was doing great, no lag, no extensor lag, anything like that. It was just that dang stiffness of the thumb IP joint into flexion. That was his main goal. He wanted his thumb tip to bend more. So he was coming in, we were mobilizing the joint, we were stretching it passively. He has a static progressive thumb IP flexion splint he was using religiously at home to try to get him more motion. So we did this for a couple months, worked on trying to get that IP flexion back, and initially it was improving, but very slowly. Like every progress note, we would maybe get 5 degrees of flexion in the IP joint. So we get to a progress note and it had maybe improved like 1 degree. We were really reaching that plateau. And he had been still following up with his surgeon. So I kind of told him, I'm like, we're kind of reaching a plateau. He had the end feel was pretty hard in that joint. So I suggested he go back to his surgeon and maybe have an x-ray, see if anything was going on in that joint. Maybe it was arthritic, something like that. So he goes back to his surgeon, and lo and behold, the reason we couldn't get more thumb flexion is because his sesamoid bone had become lodged into his IP joint and was in the way. So I'm like, no wonder
On
it was
the volar,
end feel.
on the volar side, right?
On the volar side, yes, and his injury was on the dorsal side. It was an extensor tendon injury. So it was weird. Even his surgeon texted me and was like, there was a sesamoid bone lodged in his IP joint. Like, this is so weird, especially for an injury that wasn't even on that side of the thumb.
That's very
So
weird. Was it what type of what was the mechanism of injury?
he cut it with a box cutter or a knife when he was trying to open a box. That's
Oh
how
yeah,
he.
so not like a
No, it wasn't smashed or crushed or anything like that. Um, so like a clean cut to the extensor tendon. Yeah. So his surgeon did like a local anesthetic and removed the sesamoid bone.
gosh. I
um,
wonder how big it was.
you what?
Do you like how I wonder how big the sesamoid bone was?
I'm not like super familiar with like sesamoid bone size, but it seemed pretty large. Like he took a picture of it. The surgeon took a picture of like the sesamoid bone that he removed, and he took a picture of like how far he could bend the thumb IP joint when his like after he removed it, and it was significantly more. So that was really cool. But yeah, I would have never in a million years thought the sesamoid bone would be lodged in the joint. Have you ever like seen anything like that?
Never,
It wasn't even on
never.
my
And
radar.
I wouldn't, I would think, well, like I can see why they might not get an X-ray, right? Right, but I guess it
Right.
makes sense. An X-ray is such a simple test. And
Yes,
so,
but
like, but
I
I would
know.
definitely think it'd be the EPL that was stuck in scar.
Totally. Yeah, exactly. Um, so it was just so interesting. And then, but it made me think. So he just recently had that done, like maybe a week or two ago. So he's back in therapy. We're working on still getting more of that mobility. Last time his incision was still open, but we'll start on scar management on that side so more adhesions don't form. But so interesting. And it just makes me think like, I wish I would have like maybe sent him sooner, to have an x-ray because there was a bone in the way.
Yeah, but
um,
in some ways too, maybe. Yeah, they might have not. Like if it was earlier, they might be like, well, it's pretty normal to have a stiff IP after an
yeah,
EPL. So I don't know.
I know that's so true too. But yeah,
Or
so
did you feel like, did he have pain on the volar side at all?
no. Mm-mm.
But in your mind, did you think this doesn't seem right?
Yeah, because it was like
Oh,
it was a hard end feel. Like it didn't. This like is weird, but didn't feel like it was his EPL stuck in adhesions, and his scar like on his dorsal thumb was really pliable. that kind of thing. So it didn't ever feel like adhesions. That's why I was like maybe like the joint became like arthritic or something. But I know now
No, that's
looking,
good to know, though, right? I think that's good to share with share with
yeah,
everyone because we
because
don't know.
honestly, we don't know, and I guess I kind of forget about sesamoid bones and the
Yeah,
just in the
because we
so
never really talk about them, right? They don't really
yeah,
have
they're
a
not
value
like
in what we do, or we're not really addressing them that often.
right. Yeah, but that kind of made me think. Like, do you have like a time frame of when like something like that occurs that you're like, let's go back and see if we can get more imaging, or do you do what I did and kind of go till we actually reach a plateau?
I mean, I probably would have done what you did, but I think the hard and feel would be, like a flag to me, but also like, and I know they typically follow up with their surgeon once a month, right? So I think even, yeah, of course, the sooner you address it, the better, but also, a couple of weeks, I don't know,
Could have
how
made a big difference.
significant difference that would have made. Or
Okay,
sometimes I've even heard surgeons say, especially with tendon injuries, we have to wait for the tissues to reach that tissue equilibrium,
totally.
meaning that they've gone through the inflammatory and the proliferative phase before we're going to even do any surgery. So I wonder if it would have been earlier, if they would have even waited to do surgery just to decrease the chances of having like an inflammatory response.
Oh yeah, that makes sense. Okay. Yeah, that's a good point. That makes me feel better. It was so
But
funny
I
when
don't know. So
the
how much
patient
range of motion did he gain after the
um
surgery?
so when he came back into me, he was in a lot of pain, just like post-op pain, but he still got 10 like immediately 10 more degrees than before the surgery, before we had worked on it at all. So that was good. So I expect him to continue progressing. Um,
Interesting.
he's very excited. He's like he called me after he saw his doctor, and he's like, "You're never gonna guess." And I'm like, "What?" He's like, "There's a bone." I'm like, "What are you talking about?" I'm like, "Oh, a sesamoid bone. That's crazy."
Yeah.
But
And
yeah,
so as we were like talking about this earlier before we got on, Alice and I were like just reviewing sesamoid bones, and they can be in the joint capsule. So I suppose a little shift, or maybe, even, holding it in a prolonged position, maybe that sesamoid just kind of floated into the joint space and it
got
was,
in the
but
way.
super rare. I wonder
Yeah,
if there's any reports of it in the literature.
I know. I wonder because I was talking to his surgeon a little bit about it too, and he said he has seen something like that happen, but with a volar injury. You know what I mean? Like it was an injury on that side
Yeah.
of the.
And I think
Um,
that would make sense.
that would make sense, right? But yeah, not for an extensor tendon
Yeah,
laceration.
it would be an interesting case for to write up.
Yeah, that's true.
Maybe the next capstone student.
Oh yeah, great idea. Yeah, so I just wanted to talk about
Yeah.
that, and yeah, I wonder if there's any more stories out there like that.
Yeah. Well, thank you for sharing. And if anybody has any stories or anything to share, or insights or patient cases, please reach out to us at Hand Therapy Academy, or you can email us at info@handtherapyacademy.